Hello, my name is Wood Pope. I'm a general orthopedic surgeon here at Ortho Georgia, specializing in shoulder, hip, and knee conditions. And I'd like to talk to you today about hip replacement. Now, most of patients that have hip replacement have battled hip pain and stiffness for many years, often due to an arthritic condition. There are occasionally some patients that wind up with hip replacement due to traumatic falls and fractures. But I wanted to talk to you today about the ins and outs of hip replacement. And this model here is a modern day hip replacement. The surgery itself is typically about an hour long, and there are two types of anesthesia that you may receive. One is a general anesthetic. The other is a spinal anesthetic. The spinal typically numbs you from the waist down, and you are sedated so that you don't recall any of the whereabouts of the operating room, but you don't feel anything below the waist, so we're able to perform the surgery without any pain. This is a modern day hip replacement. We can approach this from several different areas of the body. You can approach it anteriorly, you can approach it laterally, or you can approach it posterior laterally. Your hip surgeon will discuss pros and cons of each of those approaches with you. We will make dissection down to the hip joint, and this gives us access to the hip. A cut is made across the base of the femoral neck, and the diseased part of the femoral head and neck is removed. That then will give us access to the socket within the pelvis. This is a model of the pelvis. The pelvis is then reamed sequentially to a size appropriate for each individual, and a metal cup with a real porous trabecular metal on the back side of the cup is mounted into the pelvis. There are typically a hole or two in the cup if a screw were to be needed for fixation. Usually that's not necessary. Usually only about 10% of the cases are screws required. That then is the cup has a polyethylene liner. This polyethylene liner is then affixed to the cup, and this is the bearing surface of the acetabular cup. Next, attention is turned to the femur, and the cut across the neck gives us access to the intramedullary canal of the femur. And this stem, which is porous coated in the same variety of metal on the backside of the acetabular cup, for the proximal 40% of the stem is then placed down inside the femoral canal with typically a ceramic ball, and then this ceramic ball will rotate within that polyethylene liner, and that gives you a new ball and socket articulation that typically will alleviate the pain and stiffness encountered in arthritic hips. As I said before, the surgery typically is about an hour. You then are awoken from your anesthesia and transferred to your recovery room, where you will spend typically about an hour to an hour and a half waking up. If this is done in an outpatient surgery center setting, you typically have therapy come visit you in the recovery room. If it's done in an inpatient setting, you typically are then transferred from the recovery room to the hospital floor, where you will go to your room. Therapy then will visit you the day of surgery, and you will be up walking with a rolling walker, placing full weight on that extremity. Most folks will then use that walker typically about 10 to 14 days, and then they will transition to a cane when they and their therapist have supreme confidence that they're ready to do so. Most patients will wind up taking pain medicine for a couple weeks, some a little shorter, some a little longer. We also will place you on an anticoagulant, typically in the form of a baby aspirin, a couple times a day for about 4 weeks postoperatively, to limit any risk of blood clot. I always tell my patients the most important thing in both recovery of joint replacement and warding off any blood clot is to be up and be mobile as quickly as you possibly can. We typically see patients 2 weeks postoperatively to check their incision, make sure they're healing appropriately. I then will see folks at about the 6-week mark to ensure that they're recovering as expected, and then I typically see them again at about the 3-month mark. With hips, the recovery is remarkably fast compared to some other joint replacements that we do. Usually by 6 weeks, folks are off of their cane altogether. They're back in to the office. They state that their pain is typically better than preoperative levels and their function is higher than preoperative levels. And then by 3 months follow-up, they typically come back and say that they feel as if the hip is their normal anatomic hip, that they can't tell there's hardly anything in there at all. And they're back to really performing any and all activities they desire. If you think you're a candidate for hip replacement or experiencing hip pain and symptoms, please feel free to come have an evaluation at Ortho Georgia.